Namaskar. Good morning. It's not very bright again in London. Never mind. We will make ourselves bright.
Just give me a second. It's not ready yet. Just give me a second. Hold on. I'm trying to get it on the Facebook. Live on Facebook. Just give me a second. You can start now. That's it. Thank you.
Namaskar. Good morning. Om. Jai Sri Krishna. Jai Sri Radhe. Jai Mata Di. Today is 5th of June. The last day celebration of Platinum Jubilee of our Queen. So much is going on. Everybody is busy watching those programs. We also had street party yesterday. There were more than 100 people and everybody enjoyed. There was a lot of dancing, singing. As you know, Punjabi people, they are always keen to have drum and dancing. So we had a lot of food and dancing yesterday on our street. I'm sure you all must have some function somewhere. Never mind. Once again, thank you very much, Shamanji, letting me do this seva. I love my company on the Zoom. Family of Zoom is lovely. They are very cooperative and I hope they are enjoying. Let's sit straight.
You're lovely.
Okay. Today there will be a lot of them. Come on, we will doing our Kirtan Yoga. Already I started with that and you are doing your warming up exercises. Now let's start as we do, always with prayer. Chanting of Om. Sit straight, hands are in Dhyan Mudra. Put it on your knees. Lift up your spine, shoulder behind. Relax your body and the mind. Take a long deep breath from the nostril. Chanting the word Om from the mouth 3 times. Yesterday, I think I did quite in detail Om chanting, its benefit. So now today we have to concentrate on that. So many benefits, so many benefits. With full faith and surrender, Om chanting. Om Bhurbhuva Swaha Tasaviturvareniyam Bhargo Devasya Dhimai Dhiyo Yonam Prachodayat. Om Sarve Bhavantu Sukhina Sarve Santu Niramaya Sarve Bhadrani Pashantu Ma Kashchit Dukh Bhag Bhave. Om Shanti Shanti Shanti. Let's all pray to Supreme Power. Everybody should be healthy. wealthy, enjoy prosperity. Nobody should suffer from any ailment, whether that is physical, mental, spiritual, social, emotional, financial. With these good thoughts, we'll start our session of yoga, keeping in mind all the precautions. Follow your body. Just listen to your body. The class is going on for everyone, but you have to look after yourself. How much I can do? Hypertensive heart problem, severe acidity, severe asthma, severe backache. Have to be very, very careful how much they can do. Please try to do it. If we don't do it, we are not going to get better. This is our self-experience. By doing yoga practice every day, we are getting better, better, and better. And we are more happy and cheerful. We are socializing more. We have got so many friends. And this COVID pandemic has produced so many families on the Zoom, far and away. On my Zoom, I get people from South Africa, America, Canada, even Delhi, India. So many friends we have developed by this Zoom. So that's why we should enjoy in the company of everyone and encourage others. What is yoga? Yoga means getting connected. With what? Yoga is Sanskrit word, yog. Yog. So we are getting connected first with ourselves, our all the senses, Karam Yoga, Gyan Yoga, Indriya, sab, they get together with our mind, and then we get connected with the superpower. That is the idea to getting into yoga. The ultimate aim of yoga was to get into the stage of samadhi, the oneness of the soul with the super soul. So that's why people, why they're happy. Their stress is gone. So that's why we are practicing every day, every day. Now the dose is like allopathic dose, depending upon your conditions, whether you are doing as a preventive method, not to get the disease, or you are suffering from various ailments and you want to get better. That's why you have to increase your duration of this yoga practice. And in this yoga practice, what we are doing here, we are doing three main things. The first and the foremost is pranayama, to control our respiration, the regulation of our respiration, because we don't know how to breathe even. We do shallow breathing and our lungs are not functioning properly because they are only working 1/4 of their capacity. So by doing this pranayama, deep breathing in and out from the nostril, we are increasing the capacity of lungs to get rid of all the problem of the respiratory system. And the lungs are getting active every day, and various other benefits. The whole system is covered, starting from your central nervous system, this brain. People are suffering from dementia, loss of memory, agitation, anger, hatred, and get rid of those, plus central nervous system diseases like MS, multiple sclerosis, Parkinsonism, and motor neuron disease, which is not uncommon. Then they're suffering from strokes, paralysis. Then coming to the respiratory system, upper, there are two, upper respiratory system and lower respiratory system. So getting better with our cough and cold, sinusitis, coming to the laryngitis, coming down there to our lungs, we are getting better, not to suffer from bronchitis, pneumonia, bronchiectasis, emphysema, and pulmonary fibrosis, which is quite common at this age. As we are growing up, everything is getting rid of us, like all the faculties are going on. Look at your skin. Look at when we were a baby or when we were a young woman. And most of us got married. Look at those pictures. We were so young. Look at our skin now. There are wrinkles all over. But we should be proud of these wrinkles. Why? With the blessing of Lord, we have reached that age to have the wrinkles. See, we should be happy. Skin changes is there. Our eyes are going, vision is going, hearing is going, even the voice is going. When we talk, people can't understand because the voice is so low tone. So these things are happening, but we should be happy. Why not? To prevent that, we are doing this yoga practice. And some of us are suffering from various ailments. See, we don't know each other what we are suffering. Yes, do we know? Do you know what I am suffering? Yes, nobody knows. But we are all suffering. Diabetes, hypertension, obesity, breathing problem, breathlessness is so common at this age. We are anemic. Our joints are not working. But by doing this yoga practice every day, for long duration, you are getting better. Okay, so these are the most important points I wanted to cover. Today, I will be targeting at this golden age, the variation of the poses, so that everybody will be doing at their own pace. So let's start now. Bhadrika Pranayama. Sit straight, hands are in Dhyan Mudra. Your full concentration is on your breath or on the third eye. Here, Bhrakuti. This is the area, Agya Chakra. We call it power of authorities here. As I mentioned yesterday, those three nadis, the left Ida, right Pingla, and center Sushmana, they started from your base chakra and going up, and getting together here as Sangam. Yesterday we lot of that Prayagraj, Jai. Sangam, Triveni Sangam is here. This is our power of authority. We use this for meditation. And you can rub this. If you can't sleep, don't go on rubbing here. You will go into sleep because you are activating your pineal gland, which is responsible for my sleep. It produces special hormones, melatonin, which make us sleep. And by nature, you know, when the sun is there, that level goes down. When the evening comes, we are all very sleepy. We want to sleep. That's why Lord made day and night. Night for rest, day for working. So we'll take long deep breath from the nostril at your own pace, 2.5 seconds in and out, or you can take it longer. Slowly and slowly, try to take deep breath. Deep breath. Make sure the duration of inhaling, that is your purvak, we call it, and the rechak is when you exhale out. That should be equal duration. Now you can do this slow speed, medium speed, not fast speed on the Zoom. No fast speed on the Zoom. Make your chest is expanding. Put your hand on the chest and the abdomen and feel the movement. Feel the movement. See? One hand here, one hand here. Chest is expanding when I'm breathing in. Chest is expanding. Diaphragm is going down. That's why the stomach is coming out. When I breathe out, diaphragm will go up. My chest will get small, constricted, and the abdomen will go back. This is known as diaphragmatic breathing or thoracic breathing. In our yoga protocol, we don't have any abdominal breathing. Not at all. All nostril, thoracic, or you call diaphragmatic breathing. Enjoy every breath. What's going to happen? Increasing the oxygen level in the whole body. This oxygen is carried by the red blood cells to every cell of my body. Over there, sugar is there in the cell. Oxygen will burn the sugar and produce energy. That's how when we start doing it, we are very, very slow. And we are waken up, made more strong by this oxygen, which is produce the energy slowly and slowly. And activating rest of my systems also, cardiovascular system, digestive system, excretory system, reproductive system, make my mind very stable. Even this breath is going to regulate my temperature even. Take away all the toxins. This body is full of toxins. Get rid of all the toxins. Production of good hormones. Get rid of bad, our lipids. Get better with the better lipids level. Even you can lose weight by just breathing in and out. Go on chanting inside, any mantra, any dhun. Om. With every breathing in and breathing out. Om. Well done. Raise your arms up. Rub your palms 50 to 20 times. Generate the heat. Simple physiology. Physics, rather. Physics. This is physics. Put it on your eyes. Feel the warmth on your face. This is very good for the eyesight. Get rid of any problem with the eyes. Burning eye, itchy eye, discharge from the eye, for the cataract, for glaucoma. Once the temperature back to face temperature of my hand, open your eyes very slowly, remove the hand, give a massage on your face. At the lower eyelids, to get rid of any black patches or swelling there, puffiness. The lateral angle, the eyebrows, the temple region, take away all the tension and the headache, and activating that big nerve known as trigeminal nerve. Over the forehead, over the head. Love yourself. Love yourself. Come down more. One finger in front of the ear, one behind. Here you are activating your vagus nerve and the lymphatic system also. Come down more at the throat region, not to get sore throat. If you are having one, this will get better. Massaging the throat area, the tonsillitis, the pharyngitis even. Then come down on the thyroid gland, parathyroid gland, which is behind 4 lobes, and your vocal cords. Now do acupressure on your ears because there are so many organs represented on the ear. Giddiness, vertigo, hearing problem, tinnitus. Pull it nicely with medium force, medium. Come on. Then the lower part, we'll put our earrings, pull it down with a smile on your face. This is not punishment. This is my therapy. Hold it at the top and rotate clockwise, anti-clockwise. Very good. Very good. Carry on clockwise, anti-clockwise. Then try to massage inner side of your ear. There are lots of points there also. There's so many, more than maybe 700 points there. Difficult to remember. For arthritis, bronchitis, pneumonia, period pain, dysmenorrhea, young girl having period pain. Give a nice massage at the back also. Very good. Get rid of this tinnitus. You can do like this also. Tinnitus is not uncommon at this age. Tinnitus is the sound coming in your ears, very annoying sounds, like radio is on. Tinnitus. What should we do? There's no cure in the medical field of allopathy. Doctor will say, live with it, ignore it. It's very difficult, but yoga has got some ways in which we get better or get rid of it. Anulom Vilom is good. And then you can just do like this and then open your mouth wide. As wide you can. Hold it when you are opening. Other thing you can do is, it's known as Karn Rog Antik Pranayama. Breathe in from the nostril, then pinch your nostril, blow your lips and blow out from the cheeks. The air will come out from your ears. This is very good for tinnitus, hearing problem. And when we go on the flight, in the plane, we get blocked ear because there is imbalance of air in our canal, ear canal. So this is one is very good, very good. So let's start it. We'll do 2 times only. Breathe in from the nostril, mouth is closed. Then pinch your nose and blow out your cheeks. Blow. The air is coming out. Very good for the hearing problem also. Breathe in. Pinch your nose and blow out. Now I want to get very active. So the warming up we will be doing will be very, very gentle. In this golden age, see this age, we are losing our immunity completely. So how to increase the immunity to fight against any virus, bacteria, fungus, or any other foreign particle, which is going to give us problem. So we want to increase our immunity. I'm going to demonstrate very, very simple steps you can do in the house. You don't have to go to any gym. You can do yourself in your home. It's so easy. Just stand up, please. Very, very simple. First is you just move your feet. Go on tiptoes. Just stand like this. If your balance is not very good, keep a chair nearby. Don't have a fall. Go tiptoes, then on the heel. Tiptoes, then on the heel. Tiptoes, then on the heel. Tiptoes. Stand like this, hold the chair nearby. Then go on the heel. Then lift up your forefoot. Now again, stand on your forefoot. Then stand on your heel. 1, 2, 3, 4. Go on the heel, alternating forefoot and the heel. This is very good to activate all your joints of your foot, even the knees getting some exercise when you're doing this. Plus, this is very good if you're suffering pain at your heel, which is so common, you know. Pain we get on our heel, known as plantar fasciitis. For this is very good. Carry on on the forefoot. Stay a little bit time there. Then go down and go on your heels. Stay there. 1. Hold. No rush. Go down. Go on the heels now. Lift up your forefoot for in front, you know. 1, 2. 1, 2. 1, 2. 1, 2. Then do like this at your own pace. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Other 1, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Carry on. 1, 2, 3, 4. Do according to your own capacity. 1, 2, 3, 4. Marching. Come on. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. The next one. Very easy. Get hold of the back of the chair. Raise your arms up. And the leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now other one. So move your chair other side. See? 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, the next one is very simple. Go on the chair. One, 2, 3, 4, 5, 6, 7, You're doing your sketching while doing this. Yesterday we did other way around. Very good. Carry on. Okay, well done. The next one is we want to do some cardiac workout. So what to do? Again, we want to improve our knee joint problem, our feet. So we are going up and down the stair. Up and down the stair. So my staircase, I am use my stool. This is my staircase. My stool is my staircase. Now you keep the chair nearby. Now, see, this is my staircase. This height is more than enough. See, one, look at your body, where the action is occurring. Knees are bending, hip is moving. And the feet is also getting the advantage, the ankle. 2, 3, 4, 5, 6, 7, 8, 9, 10. Other 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now let's say I am quite okay. My joints are not that bad. You can do it fast and increase your heart rate and the respiratory rate. 1, 2, 3, 4, 5, 6, not more than that. 1, 2, 3, 4, 5, 6. Carry on, carry on, carry on. Depending upon how your knees are. Pain in the knee. Right knee, I've got pain. So I did less. My heart rate is gone up. My respiratory rate is gone up. This will help me to produce more oxygen and get rid of extra fat also. So these things are very, very simple, but very important. We should do every day, every day, every day. There's no need to go to any gym. You produce a gym in your house, you know. Need simple things. Now let's sit down and take a couple of deep breaths. Now here you can exhale from your mouth. Very good, very good. Comes to the hand now. Very good for rheumatoid arthritis, pins and needles. Go on breathing from the nostril. The Bhatrika Pranayama, breathing in and out. Pranayama is going on side by side. Carry on with a smile on your face. Make a fist. Spread your fingers. Very good. You are doing well. Arms down. Hand is facing the ground. Going up. down and up, down and up, down and up. And do like this. Good for your shoulders also. The elbow, the wrist, the fingers. Other side, this side now. Very good. Very good. Then do like this also. Very good. Well done. Arms coming up. Good for the neck, the shoulder, the elbow, wrist. Getting rid of extra fat from the arms. Go on, breathe in. Coming up, breathe in. Going down, breathe out. Breathe in. Breathe in. Breathe out. And go on the side, stretch at the shoulder level, not up or down. Come on. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Rotate your shoulders. Look after your body. Don't overdo it. Carry on forward and backward. What is happening? It is not only the arms are getting the benefit, the chest also, the abdominal organs also. This abdominal wall is getting some exercise to get rid of fat from there. Toning up. Come on. Forward. Backward. I am here for enjoyment, not for punishment. Carry on. Carry on. Very good. Hold it at your wrist or you can hold at the hands. Then we are going up. Breathe in, go up, stretch, stretch. Then bring the arms one side. The right arm is quite behind my skull, not in front like this. Behind. What else is happening? So much pressure is coming in my axilla. There are lymph glands there. I am activating them also. And try to pull your left arm as far down as you can without breaking your bones. Bones are very fragile at this age. Osteopenia, brittle bones. Osteopenia, osteoporosis. This is a silent disease. We don't know if we are suffering. So we have to be very careful with our bones, with any movement. But this is a very common condition. After the age of 40 or 50, they say 1 in 3 women is suffering and 1 in 5 men is suffering from these brittle bones. They get fracture with minimum movement of the body. They can get wrist fracture, they can get fracture of the vertebral column, or anywhere else they can get this, the hip also. See how many these elderly women or men are going for hip fracture. Very serious, very costly to the NHS also. Up again. So look after your bones. What exercise you have done already, you are increasing your bone mass, making your ligaments quite active. The 5 exercises that I've done already, that is going to improve my bones. Then do a lot of dancing, clapping, singing, swimming. They all help us. Very good. Up again. Interlock your fingers. Put it lower part of skull and upper part of neck. Give pressure from the hand to the neck. Close your eyes and focus on the area you're working on. And pull in your abdominal muscles. Tone up their arms. Go on breathing. Then breathe out from the nostril while you're releasing the pressure. Breathe in. Give the pressure. Breathe out and release. If you're quite active, no problem with your shoulders, do like this. Making your joints much loose this way. But don't overdo it, otherwise there will be pain. You won't be able to do any work in the house. Then on the side, kanpati, as we say, kanpati. Get rid of any stress, the tension headache. Other one. Interlock your fingers, put it on the forehead. Give pressure from the hand to the forehead and from the forehead to the hand. Focus where you are giving this pressure. What is happening to my body? You might be feeling slight tremor in your neck region. That indicates there was some discomfort in the neck because of the vata problem. You know, there are 3 dosha in the body: Pitta, Kapha and Vata. All joint pains, digestive problems are due to increased amount of air in the body. Vata dosh. Very good. Getting rid of any tension. What else is helping? If we do this for 10 minutes, you will be sleeping soon. Lot of relaxation. Because you are pressing your Agya Chakra. You are pressing at your Agya Chakra. And if you keep it for a long time, you feel very relaxed because of this activation of pineal gland. Very good, well done. Now hands on your knees, give a good massage, rotate your shoulders. Breathe in and breathe out. Bhatrika Pranayama is going on. Well done. Well done. Well done. Love your knees. They're very important. Well done. The next one is Kapalbhati. Yesterday we did some 4 or 5 points of our acupressure. I will continue today. Kapalbhati is a very important pranayam, detoxifying pranayam, very strong pranayam. We call it king of pranayam, king. You know Khichdi Mudra, remember? We do it. Take your tongue out and roll it and touch the pet. They call it that queen of mudras. That Khichdi Mudra is known as queen of mudra. There you are. Queen Jubilee is going on. Our queen is here, Khichdi Mudra. So, if you are suffering from hypertension, very severe one, please don't do it. Suffering from glaucoma, don't do it. You're pregnant or you're having bleeding from anywhere, please don't do Kapalbhati. Always get the instruction of your yoga teacher or your physician if you are suitable before starting any type of yoga practice, if you are in doubt. You have to protect yourself. After major surgery, you don't do for 4 to 6 months, even after minor surgery. So please keep in mind all these precautions. In Kapalbhati, we are just focusing on our exhaling. Automatically, we are breathing in. That is passive, as we say. So sit straight. And we are going to do, yesterday somebody asked when most of the people are gone, about the liver point. Where is my liver point? Liver point is on your right hand. The first line, the level is between the little finger and the ring finger, this area. The first line on your right hand. The gallbladder and the liver. So if you are suffering fatty liver, cirrhosis of liver, hepatitis, even the cancer of liver, you are supposed to do this point. The first line at your palm, level is the little finger and the ring finger, that down below, the soft area. So we are doing that. Keep it on your knees, lift up your spine, and go on pressing with the pulp of your thumb. You can use a pencil as I did yesterday, or if you have got that machine, which is, Sarvaj is talking too much about it because that is very helpful. You can do with that. Otherwise, do with your thumb. I have got the pencil, so I can use the pencil. See, I can use the pencil just to show you. Here it is. Can you see? Here it is, this point. You have to press this point. Go on pressing on the right hand. Have you seen that? This line, the first line on your palm, there are 3 lines, you know. The upper one, this is the area. You have to press this point. Press it like with your thumb, or get hold of a pencil and do the other side of that. Or you can do with this pencil, wooden pencil for the acupressure. You go on pressing like this, go on breathing. You do your Bhadrika Pranayama, or you can do Kapalbhati also. Carry on Kapalbhati. So we are releasing the toxins from our liver. As we are breathing also during Kapalbhati, we are throwing out the toxin from our respiration also. Pressing it. Do Kapalbhati for 1 minute. Come on. Well done. The next one is our pancreas point for the diabetes. This is in both the hands. That is, the level is between your ring finger and the little finger, the middle part of between your first line and the second line. Press that, this one, here. This is the area. Between the first line and the second line, level is between your ring finger, little finger. Press this point for diabetes. And we do both the hands. Put it on your knees. I'm just for demonstration, I'm lifting it like this. And your mind should be on your pancreas. I want to activate my pancreas. The beta cells, I am requesting them to work better. I want to get better from my diabetes. And Kapalbhati will help me because I am activating my pancreas, giving a nice jogging on the pancreas. This is known as dharana, focusing on one point. Ashtanga Yoga, 8 limbs of yoga, which is compiled by our Rishi Patanjali Maharaj. Yam Niyam, Asan, Pranayam, Pratyahar, Dharana, Dhyan and Samadhi. Smile on your face. I am getting better. To get rid of these problems, we have to do every step for a long time now. At home, you can practice long time. There in the class, the time flies, you know. So you have done that point. Now coming to your pain, pain and pain. This is the thing. Do this one, this area. Press it for any pain. You have to press quite hard. And if you're getting pain, pressing, that means some problem is on that area of the body. Maybe you're having knee pain. So press this hard. Go on doing Kapalbhati. Do other side also. This dimple down there. No, this is your thumb, this is your index finger. The dimple is down here, the soft area. Press it hard. Well done. The next is getting too much gas in the body. Acidity. So do this point here. This point here. See, coming to the base of the thumb and this point down there. This is your for stomach, for acidity. Press this point. This one. Thyroid is the raised area as we did yesterday. This is just, you can say base of the tongue and this sort of web in between your index finger and the thumb and this soft area for the stomach. Acidity, get rid of acidity. Press it with Kapalbhati. Now, if you got hyperacidity, quite severe one, let's say, then you have to be very gentle with the Kapalbhati. Do it slowly. Other one also. Other hand. The next one is very important. For the hair problems, these hair, we are losing hair. We are getting premature graying of the hair, not me. If in your family someone is getting, at a younger age, they're getting gray hair, they should be doing this rubbing of the nails, not the thumb. Thumb is far away. Just go on rubbing and do Kapalbhati. This you can do 5 minutes morning, evening. Very good. Kapalbhati with this nail rubbing. This will make our hair looking well, not very, very soft. Might be helping us to get rid of this too much losing hair. Do Kapalbhati with this. If you can't manage Kapalbhati, just do Bhadrika, breathing in and out. And concentrate on your hair. Hair. Rubbing up the nails without putting any nail polish. Remove the polish. Keep the thumb far away, otherwise it's trouble. They say you might develop mustaches and beard. Now come to the kidney point to get rid of these toxins through the urine. That is in the center of your palm. So press that and do Kapalbhati. Other hand, kidney point in the center of your palm. Same points are on your soul. Well done, well done. Now relax yourself, take a few breaths in and out. Lay your arms up, rub your palms. Put them on your eyes. Open the eyes, remove the hand. Come on, do some churning now. And do with this mudra. This is spinal mudra, Merudand mudra. Lift up our spine. And move your legs also. The smile on the face. Breathing in and out. Carry on. Well done. Chakyasana. Chakyasana. You can do sitting down on the mat or on the chair even. No problem. We can cover about more than 90% asana sitting on the chair. Carry on. Well done. The next one, I'm going to do some poses now today to make me better, my spine, get rid of extra weight, and activation of all these internal organs. Yes, the first one is Mandukasana. Thumb in, put it here, breathe in, breathe out. Look at the ground and then lift up in front. Now here, if you can manage, you can do Kapalbhati. Otherwise, don't worry. Okay? This is very good for the pancreas. Main action is working on the pancreas. Some effect on the liver, spleen, intestine. Then breathe in and come up very slowly. Now you can do your liver, right side, and spleen, left side, the same level. Press it in. Breathe in, breathe out fully. Then breathe in and come up. Now left hand at the navel, right at the top. Breathe in, breathe out fully. Squeeze your stomach in. This is very good to control your abdomen. Then go down and look straight and do Kapalbhati. Carry on at your own pace. Now try to increase the duration if you can, because the effect will come if we do for a long time. Get better with the diabetes, liver problem, kidney problem. The next one is your Shashakasana, the rabbit pose. Breathe in, take your arms up, stretch, look at the ceiling. Here you are doing your neck movement also. Look at the ceiling. And do Kapalbhati if you can manage. Relax. Now again, breathe in, take your arms up. Now go down, keeping in mind all the precautions. Hypertensive heart problem, backache, osteopenia, osteoporosis. Don't bend forward. Look after your body. If there's a backache, don't bend forward. And do Kapalbhati. Always look at the precautions. Go on doing Kapalbhati. If you can manage, don't push yourself. Breathe in and come up. Again, raise your arms up. Stretch. Stretching is very important to activate all those muscles and ligaments. Then bring your arms very slowly from the side. No rush. Love your body. Next one is Gomukhasana. We are doing every day. Right leg is over the left one. The right arm is going up very close to the ear. And trying to touch the hand with the left one is also going up to meet the right one. Then you can look up the ceiling. If you can manage to Kapalbhati, please do it. We are only doing maybe maximum 10 times because time doesn't permit. Otherwise, we are supposed to do for 1 minute, 2 minutes, if really we want to get better. That's what we are seeing on the Asta and Sanskar channel every day. They are doing for 10 minutes each poses. And they're getting better in 7 days. Plus, they have added therapies also. Ayurveda, the medicines, herbal medicine, hydrotherapy, all natural therapies going on there. And even you might have seen the leeches treatment, leeches and batik. Relax. Other side. 5 poses are more than enough with the pranayama. Some gentle exercises. Relax. And you can do changes you can do every day, you know. Some day you are doing poses. Pranayama is a must. Every day pranayama is a must. Poses you are doing, some more exercise you are doing. There are so many exercises one can do. The next one is known as Vakarasana. Twisted pose. Bend your right knee. Stretch out your left leg in front. See? If we can't do on the floor, we can modify it. We can modify it. Bend your right knee. Stretch out the left leg like this. Hold your right knee with the left hand like this on lateral side of your knee. Take your right arm behind, close to your hip, not far away. And you're twisting towards the right side. And go on doing Kapalbhati. By doing this, you are activating the left side of your body, your chest, your abdomen. Plus, you are doing your neck movement also. Relax, look straight, reverse. The left knee is bending, right one is stretch out. And I am bringing my left knee very close to the right by putting my right hand on the lateral side of my left knee. Taking the left arm behind, looking over the shoulder on the left side. Kapalbhati. Then breathe in and look straight. The next one is known as Yog Mudra Asana. This is best done in Padmasana. I can't do that. So we are doing on the chair still. Left hand at the navel, right at the top. Breathe in, breathe out. Here I'm going to look at the ground and imagine my chin is touching the ground. My chin is touching the ground. You can do Kapalbhati if you can do it. Known as Yog Mudra Asana. Very good for the brain. Increasing the circulation in the brain. Get rid of dementia, loss of memory, lack of concentration. Good for the hair growth. plus other benefits on the abdominal organs. Then breathe in, come up very slowly. And the other variation of this is, I will sit like this to demonstrate. Breathe in. Now hold your hand at the back, like this. Make your spine straight first. Breathe in. Long deep breath in. Then breathe out, come down towards the ground. Again, imagine your chin is touching the ground and I am pulling my arms up. This is giving a lot of pressure from the thighs to my abdominal organs. You can't do Kapalbhati in this pose, so don't worry. Hold it. Very good for my upper arm, my shoulders, my elbow. Plus, I am activating all internal organs. Then you breathe in, release your arms. Very good. This is known as Yog Mudra pose 2. Yog Mudra Asana pose 2. Because if we can't do in the Padmasana, we can do so many variations. That's the idea, that we have to do something, but make sure technique is correct. Otherwise, there's problem. Because these muscles, they get annoyed with us if we don't use them properly. So that's what we have done. 5 poses. This is more than enough. Pranayama we are doing throughout. And the next one is, now how to make my whole body very active. Jogging, yogic jogging. The 12 steps which we will do all. Follow your body with all the precautions as mentioned. Basic is when you breathe in when you come up, breathe out when you go down. Don't bend forward if there's a backache, heart problem, hypertension, even low blood pressure, osteopenia, osteoporosis. And don't go back if there's a hernia. Hernia can be simple hernia, big one, or you can get hiatus hernia. I think I've covered in this class. Hiatus hernia or acid reflux. Don't go back. But if you have got very small pea-sized hernia, then you can do anything and you will get better. Even Kapalbhati you can do. So let's stand up at your own pace and we will do our jogging 12 steps. Everybody knows. Simple jogging. And we will be doing with the music. is not working properly. Carry on. Very good. Now, if you're very fragile, get rid of a chair and try to do it with the help. See how much I can go up. Same thing back. Very good. Very good. Very good. The next one. So hands on your waist, bend your knees and go down. This is very good for the knee joint. Chest is straight. Stay there. And you're activating your lymphatic system from the calf muscles. They are getting a lot of pressure there. Now there is another pump like our heart pump for the lymphatic system at the calf muscles. That's how it is working. See? You can do like this. You should do like this if you have got problem with your back and we don't want to give any stress to the back. Do like this. Let's say I am suffering from osteoporosis. My bones are very brittle, but I want to do some exercise. And there's so many we can do with osteoporosis. So put hands out like this, stretch out. No tension at my vertebral column. Stay in this position for some time. Then come up slowly. Again, you can do your knee movement like this, rotating. Very easy. But I will watch out. If there's a pain in my knee, I won't be doing when taking it away too much, because you might find your pain is increased. So do as much your body allows you. Very good. The next one is spread your legs, hands in front, bend your right knee. The left one is stretch out. Come in the center, bend the left knee. Again, stay for a short time. Come in the center, all this done with the breathing in and out. Right is bent. Not much because I've got pain there. Coming in the center. Left one is more bent. Doesn't matter. Slowly and slowly. Come in the center. Hands on your waist. The right foot is facing the right side. Left one is behind. Bend your right knee. Again, I am getting hold of the chair. And look up. By doing this, you are activating your thyroid gland, parathyroid gland, your vocal cords, and the neck exercise. Look up at the ceiling. Stay there for a short time. When you breathe out, bring your right foot in front. Now the left one is facing the left side like this, straight. Hands are on my waist. Bend the left knee and look at the ceiling. And breathe out. Bring your foot. Now you can do various poses like this. We are doing, depends on how your body allows. You can put your arms up, stretching your arms. It's not a must for everyone, okay? It's your own body. So you do what is suitable to you. Okay. Now the next one is expansion of the lungs, getting rid of many other problems of your arm. And again, you are bending. So watch out for those precautions I mentioned. Open up. Very good. At your own pace. Slow, medium or fast if your body allows you. Very good. Very good. Very good. Very good. Very good. The next one for the waistline. Come on. See how much work is done here on this side when we are doing this. And I'm just sliding my left hand on my left leg. Stay in this position for some time. Then breathe in. Do other side. Stretch up close to my ear. Then go down the right bend. Stay there for a short time. Then breathe in. Take your arm. Next, you touch the opposite feet again. How much you can do. Either you're reaching your thighs, your knees, leg, or you're touching your toes. Very good. For weight reduction, activation of all the muscles and the ligaments. Very good. Very good. Very good. Very good. Next, join your feet. And here we are doing. Breathe in. Breathe out. Go down very slowly. Padhastasana. We are touching our feet. That is the path. Hasta means hand. You can go any level depending upon your body condition. How flexible you are. How much practice we have done. Stay there. Your head is hanging in the air, bringing nose close to my knee. Then breathe in. Go back slowly. And look at the ceiling. Very good for constipation. You're activating your bowels also. Again, breathe out. Go down very slowly. No rush. Hold it there for some time. Good for the brain. People do headstand. We can't do headstand. We can do like this. After the age of 40, you're not supposed to do it. Until you have started doing it from the childhood. Too many precautions for headstand. Up, stretch, bring your arms by the side very slowly. Next, 11th pose. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4 at your own capacity. The 12th one, feet one side, hips other side. Shaking your whole body. Come on. Whole body is getting exercise. Come on. Well done. Very good. Very good. Very good. Very good. Now do your shoulders always as a preventive method, not to get frozen shoulder, which is very common, especially in diabetics, clockwise, anti-clockwise. Other one, forward and backward at your own pace, breathing in and out. Pranayama is still going on. Very good. Shake your hips. 1, 2, 3, 4, 5, 6, 7, 7, 6, 5, 4, 3, 2, and 1. Very good. Okay, we are going towards the closing now. Anulom Vilom. Pranayama. Very effective. Everybody knows how to do it. Well done. Bhamri Pranayama. Very, very important. 3 times. You can do with Khichdi Mudra or without Khichdi Mudra, whatever suits you. 3 times. Udgit Pranayam. Pranam Pranayam, the 8th step. Pranam is supreme power. Om. Fix your mind either on your breath or any chakra of the body. Go on chanting inside. Silent meditation. Hands are in Dhyan Mudra. Say inside, I am never alone. I am never alone. The supreme power is always with me. We are thankful to Almighty who gave us strength to perform today's yoga. Thank you, thank you, thank you. I am never alone. Raise your arms up, rub your palms. Put the palm on your eyes. Open your eyes slowly and remove the hand. There's so much urja, the energy. Sarve bhavantu sukhina, sarve santu niramaya, sarve bhadrani pashantu, मा कश्चित् दुःख भाग भवेत्। ॐ पूर्णमिदं पूर्णात् पूर्णमुदच्यते पूर्णस्य पूर्णमादाय पूर्णमेवावशिष्यते। हरि ओम तत्सत्। हरि ओम तत्सत्। हरि ओम तत्सत्। Come on, the last Singhasan. Never forget this one. Make us so happy and cheerful. Good to my eyes, ear, nose, and throat, voice, speech even. You can do much better roaring than me. Well done, well done.
Thank you.
Thank you
Dr.
very much,
Kapur.
everybody.
Thank
What
you.
is